Okay, thank you very much. I'm Emanuele Ratti. I'm working in the Department of Philosophy here in Bristol. And I work especially in philosophy of science and technology and AI ethics, especially in the medical context. And in order to explain you what I'm interested in medical AI ethics, let me just draw you like a very quick picture of how I see AI ethics as a discipline. Okay, so I think that there are three kinds of AI ethics in healthcare. And the first one is an approach that takes a number of societal and normative desiderata of political and ethical nature, and then provide an evaluation of AI systems from the point of view of those normative commitments. And I mean, debate on explainability, trustworthiness, and transparency and safety are an example of this. Second, conceptualize AI ethics more as a technical and engineering discipline, where you have ethical concepts that are formalized and implemented as technical and design requirements of AI system, like the debate on fairness in machine learning, and ethics is literally inside the AI systems. And while I think that these two approaches have provided valuable works to which I have also contributed to, I'm often dissatisfied by the way they are thinking about AI systems as detached and in isolation from the context in which they are supposed to be implemented. So that's why I'm interested in the third approach, which I define in this way. So it's the study of how AI systems in health are adapted or maladapted to the context in which they are used, how the context of implementation react to maladapted tools, and the ethical pitfall of this. And I call this interactional AI ethics exactly because the locus of ethical analysis becomes the interaction between the AI system and the context of implementation. And so the characteristic of the context and the characteristic of the users populating that particular context become essential here. And in order to show you why this is important, let me just, let's say, consider this widely discussed case a few years ago, but from a slightly different perspective, okay? So in this paper here, Obermeyer and colleague, they found that a widely used health risk assessment algorithmic tool was performing particularly bad on black patients, and in particular it was super bad at flagging a black patient with high risk. And I mean, among the many problems that the system had, what they found was that the algorithm was using health expenditure as a proxy for health risk, which in principle makes sense because, I mean, the more you spend on health, the more it's very likely that you have some sort of, let's say, health-related problem. However, it's going to work only for a specific kind of end users with specific characteristics, like having a full-time job, having an insurance, living in a context that is conducive of health expenditure, like where you have access to healthcare, and we know how it's very important in the UK. And so what happened was that the AI practitioner were assuming that the context where the system was supposed to be implemented was populated by end users with very specific characteristics in an environment with specific features conducive of health expenditure. The moment in which you move to an environment with different end users, then it caused harm and exclusion. And the broader lesson is that the characteristic of the context of implementation and the characteristic of the users populating this context matters a lot. And this is not just for AI, like for any simple technology even. So consider bicycles, okay? So these are technical artifacts that can provide great benefits to users. So they can facilitate physical exercise, they can expand social networks, and all of that. However, these benefits will materialize only if the users have certain characteristics and if the environment is, for instance, conducive or facilitating the movement of bicycles. So if you live in the Netherlands, bicycles are great. If you live in the Amazon forest, then they might not be that good, or at least you need a different kind of bike. So the broader lesson is that, that implementing an AI system without carefully considering end users' profile and context of implementation have unpredictable ethical consequences. And in this context of interactional AI ethics, I study how I'm particularly interested in the practices of responsible transfer of AI tools across different healthcare systems. So AI tools, their design and function are usually imprinted with the priorities, values, and assumption of their context of origin, and they are optimized for specific socio-technical systems. And usually transplanting digital technology, they don't work as well, and they have these very unpredictable ethical consequences. So with my collaborators from Oxford and Leiden, we are studying how these work how these dynamics of transfer work between high-income countries versus low and middle-income countries. And these challenges scarcely been addressed in IIT so far, but it has important consequences for global equity and access to the benefit of medical AI. Thank you.